Well, good afternoon, everyone. We're going to go ahead and call the meeting to order. We've had a little tech excitement this afternoon, so apologize for those of you who are online and can't see the excitement that we've had in the room. So I'm just kidding. It's most people don't know we haven't had any excitement. So, but anyway, this is the Wednesday, September 17th, 2025 meeting of the Pikes Peak Commission on Aging. Madam Chair, we do have a quorum, and so I'll invite you to go ahead and begin introductions. We do have at least one member of our commission online today.
I see
two?
two.
Okay, great. Thank you.
I do. And we'll start with online folks introducing themselves, and we'll start with the commissioners online. Aaron. And if you're talking, Aaron, we can't hear you. Okay. Okay.
Okay, Aaron, you should be able to come on, and Steve.
Okay, thank you. Yeah,
There you go.
Sorry. Yeah. Hi. Thank you. Yes, my name is Erin Luterio. I'm based in Monument. I'm joining the meeting for the first time. So I'm really happy to be here. I've been working with older adults for a number of years, and I'm happy to be working in this capacity.
Great. We're happy to have you. Thank you. Steve?
Good afternoon, Madam Chair. Steve Schleicher, El Paso County Representative. And I do apologize by not being there in person. I'm coming down with a cold and decided not to share with you all this afternoon.
We appreciate that. Thank you. David, we'll have you introduce yourself.
Hi, my name is David. I'm an executive director with a new nonprofit in Colorado Springs. Our end goal is to help bring joy and awareness to senior isolation in our community.
And can you name your nonprofit, please?
The name of our nonprofit is called Wrinkle Friends.
Nice. Great. Welcome. And Katie?
I'll jump in. This is Jody. Katie and Tion are both case managers, and Katie is our SHIP coordinator here at the Pikes Peak Area Agency on Aging.
Okay, great. Thanks, Jody. And now we'll go to those in the room. And Kathy, we'll start with you.
Hi, I'm Kathy Sorella Smith. I'm just here.
And we're glad you are here. It's nice to see you in person.
Wanda Wood, appointee El Paso County.
And just for those of you who may not know, you don't have to push the button down, just push it once and let go. And so it doesn't have to, you don't have to hold it down when you talk, just so, and then you turn it off the same way. We've got some new ones on that end. That's why I'm letting you all know they're a little different than some of the usual microphones you see.
I'm Erin Marizella. I'm appointed by the Colorado Springs City Council and the membership chair.
Penny Whitney.
I was expecting more.
Oh, usually I talk a lot. I actually represent the Colorado Commission on Aging as a liaison.
Kent Matthews, formerly with the Family Caregiver Support Center at the Pikes Peak Area Agency on Aging. Now I'm a free agent.
And Melissa is walking. I'll introduce myself, Paula Levy. I'm chair of the Commission on Aging. I also have a caregiver consulting platform, which is Never Alone Consulting, and I am on a mission to bring an adult day program to our Pikes Peak region, which would be for seniors 60 and over that are experiencing brain change. And Kent failed to say he was on my board of directors.
And I'm Jody Barker, director of the Pikes Peak Area Agency on Aging. And then Melissa, you want to grab a mic and introduce yourself?
Melissa Martz, Pikes Peak Area Agency on Aging.
Great. Next up is a motion to approve the agenda as written.
Say it. Oh, okay. I'll move to approve.
Second.
All right, and just I'm doing this with all of our committees, so don't feel I'm picking on you. For sake of the minutes and the recording, and for folks who may not be able to see on screen, if you will announce yourself, this is so and so. I make that motion, or my name is so and so, and I'll second. If you wouldn't mind, please do that. That would be a big help for us to make sure that we have our minutes accurate for our report out. So we had a first from Kathy, and our second from Kent. Thank
Oh,
you.
I was going to have him do a take two.
Yeah, thanks.
Okay. All in favor of the motion, say aye or
Aye.
aye. Great. Motion carries unanimously. Next is the approval of the minutes of our August 20th meeting. I need a motion to approve those minutes.
Penny Whitney, I so approve.
You need to make them.
Oh, I move that we approve the minutes of the August meeting.
Great. And is there a second?
Kent Matthews, I second.
Great. Is there anyone opposed to the approval of these minutes? Hearing none, motion carries unanimously. Next, we have public comments, and we do have someone in the room that is going to talk to us today, and her name's Tina, and Melissa's going to introduce her, and then she's going to have the floor for 3 minutes.
Hi, Commission on Aging members and those in the audience online. We would like to have Tina from Meals for Moms share a few comments here with us. She gave me some really critical, good information today about food insecurity and some of the work she's doing. And so I invited her to come and share a little bit today, as well as hear more from the Commission on Aging and how our meeting runs and the content that we all talk about today. So welcome, Tina.
And I cannot see my timer, so if I go over, you can just throw something at me. Yeah. So my name is Tina. I do work for Mom's Meals. So we are a home delivered medically tailored meal program provider in the state of Colorado. So we are one of 7. And now with some of the changes to some of the community first choice waiver for individuals who are on a waiver service, medically tailored meals or home delivered meals is now an option. We do work statewide with the case management agencies, with some of the AAAs in the state, as well as some of the PACE programs in the state of Colorado, and getting their members referred over to us, and then providing their meal services for them. So ours are a little bit different because they are fresh, never frozen. So when they come delivered to the home, they're ready to put right into their refrigerator. They can go to the refrigerator, pull what they want to eat, make their choice instead of going to the freezer, pulling it out, waiting for it to defrost, and then heating it. So 92% of our members say that they prefer the fresh over the frozen. So that's a little differential for us. So I've been kind of traveling the state, just kind of seeing what's happening in the different communities. I was appointed last year to the CDPHE Health Equity Commission. So usually when I see something in the community that we can't kind of support from my employment level, I can kind of bring back to the state to kind of let them know that, hey, there's a barrier, or there's like an issue going on here that maybe we need to look at. Now with a bunch of the budget changes and budget hacking of the budgets, we're kind of looking at some of the rural counties. I've been pretty inspired going out, especially to the Montrose area, where they're actually pulling together. They're saying, well, what do you offer? What do you offer? And kind of who's left, so they can try to catch some of those individuals where there's really no program or services for them, to see who can kind of support them to kind of get over this hurdle So that was pretty inspiring. So I kind of shared that with CDPHE. This year, they had just released their annual report because we are looking at the LTSS population, and they're actually doing road shows. So if you guys are interested, if you want them to go out to Park County, Teller County, I can let them know. They'll take a team and they'll actually go over what they found and kind of some of the programs that they have in effect, and start discussing next year, which they are looking at older adults in the aging process in Colorado. So they are doing that for 2027. So now's the time to kind of put that bug in the ear or kind of start those conversations so that the state kind of has their eyes on the larger picture, especially for our rural counties and our remote cities. And so, thank you. And so that's a little bit about me. So I'm very excited to kind of be here with you guys and learn what you guys are doing. I live right down the street, so hop skipping away from me. So looking forward to hearing your guys' conversation. Awesome. Ooh, 4 minutes left. 4 seconds left.
Great. You want to stay, Tina, just in case there's questions? Does anyone have questions for Tina?
You have 1 second.
I have a question. This is Erin Marizella. What can we do to support the work you're doing?
So right now, like with the Moms Meals, that work, if you guys have individuals who might qualify for some of our services, we do take referrals. So we have 4 different programs. One, like I said, we contract with the state, so we're able to support that through the waiver system. We work with the AAAs, so we apply for some of the RFPs that they put out to see if we would become one of their providers. Like I said, we have a couple of them in the state of Colorado. We do work with some of the health plans. Colorado, not yet has the health plans kind of taken charge. It's usually the case management agencies, but in other states, it's the health plan that will actually refer and pay for the services. And then we have the self-pay option. So if you have a family, if one spouse is getting Mom's Meals and the other spouse says, well, it's just easier for both of us to get it and has the ability, our meals are between $7.99 to $8.99. So it's the full meal. So the sides and everything that comes with the meal all put together. So 4 different ones. And with CDPHE, like I said, you guys are, even if you're in your own kind of work world outside of the council, if you want them to come and present, we can probably do that in one of the communities you guys are in, just to get the voice heard and actually speak for the individuals who are in the rural counties, remote cities. Yep.
So you don't have to be a mom.
No.
Okay.
You can have a mom.
Okay.
And
that counts. Okay.
There you go.
And is there a website that explains this more in detail?
Yes. And I do have some information.
Okay, that'd be
I don't
great.
know if I can leave some out.
Absolutely.
And then kind of share with you guys. Yep.
Great. Thank you so much.
Thank you.
Oh. Steve has a question. Go right ahead.
Thank you, Madam Chair. Hi, Tina. This is Steve Schleicher. So a question that I have is, do you guys do daily or weekly deliveries? And what type of meal types are you guys doing? Breakfast, lunch, dinner, things like that are available for purchase, from some of our seniors?
Yes. So we have a full menu. So it's breakfast, lunch, and dinner, depending on how the person referring them to us. So we either do a 10 meal pack, a 21 meal pack, or a 14 meal pack. So depending on what you're authorizing and what you're referring for, we can accommodate all of the above. If you do have some unique circumstances where they just need like breakfast, we can kind of do a plan around the need.
Great. Any other questions?
Hi, Tina, Penny. So you do private pay as well as waivers. So if there's a neighbor that probably could be supported nutritionally, that could be a referral too for private pay.
Correct.
Excellent.
Yeah.
Thank you.
And so for like the AAA members, if you guys have folks who are kind of part of your program, anyone who's member facing are actually would push the referrals out to us. I can kind of schedule a time where I can kind of do an in-service and do a deeper dive into the services. And then what we do and what I like to do is actually offer you guys a sample cooler where you get breakfast, lunch, and dinner. So you can kind of see the full experience that the member has when working with us, see the packaging, unboxing, and kind of sample the meals themselves, so that when you are working with folks and they're like, well, there's 7 in the community, which one do you suggest? You have firsthand knowledge on what it's like to work with us. So
Do you work with home health, home non-medical care organizations to support maybe some of their clients?
So in Colorado, we, like I said, the case management agencies, and the AAAs, and then some self-pay. We also have another side of the house that I don't, I'm not the face for, but we do have a Medicare team that does, are the in lieu of services that they do offer. So if someone is hospitalized and they are released and they have like a dietary plan, we actually do the 30-day meals to kind of help them transition back into the home. And that once the doctor prescribes it, usually Medicare will cover it. I'm not too sure if TRICARE is covering it yet in the state of Colorado, but I do Medicare does, and we offer that service as well. So it's not full-time, it's just until they're home and are able to eat and kind of stay stable in the home. So bunch of different programs. Yeah.
That's fantastic. Thank you for sharing.
Any other questions? Ready for karaoke?
Yeah,
What?
go
No?
for it.
Thank you.
All right. Next is item number 5, action items.
No action items this month.
All right. Moving on. We have information items, number 6, and we'll start with the membership committee. Erin Marizella.
Thank you, Paula. First, I would like to officially welcome Erin, and I will have Erin pronounce her last name for me as the other Erin on the commission, whose name is also difficult to pronounce. But Erin is joining us. She's been officially appointed by the City of Monument. Erin, if you're able to unmute, please help me with your last name.
Yes, it's Eleuterio. Sounds like Eat Your Cheerios.
Nice.
Yeah.
It's like Marizella, like mozzarella. So I like it.
Oh, good. Love it.
Yes. Welcome. Welcome officially to the commission. I feel like it was really smooth onboarding, and I'm so happy to have you here, to have your voice and to have you bringing your service to the people in your community. So thank you for being here.
Thank you. Happy to be here.
Yeah. And I want to check in with Melissa on a couple of people who we had been talking with in, where was it? Was it not Woodland Park? Was it Cripple Creek? Some people who had reached out, and Paula met them a couple months ago, and we were seeing if they were interested and checking in on the appointment process. Is there anybody else in the matrix right now?
I think those people all, we had a staff person from Community of Caring, Aspen Mine Center, but they are not able to attend community meetings in this capacity because of how they're paid.
Okay.
So they were not a candidate, but of course we did get Bob Foster appointed from the Teller County Commissioners, but he's on vacation right now, so he's not with us. And so that's our update from the Teller County area.
Okay. So looking at I have pulled up our roster right now, and looking at our roster, it looks like Kathy, who's here with us today, her appointment expires at the end of this year, and we still have many open member seats, and I won't read through them all right now. But my mission, as long as I've been on the commission and as long as I've been in the seat, has been to work to find people to join the commission. And I've discovered that it's just kind of, it's not a one and done process. It's not cookie cutter. Every municipality appoints differently, and it takes time, and it takes conversations, and it takes meetings, and finding the right person is not as straightforward as I thought that it would be when I joined. And I say that because I'm hoping that someone who's on the commission now will be able to step into the membership role next year. I would like to let everybody know, I've let Melissa know and Paula and Jody, but I'm going to be stepping off the board at the end of this calendar year. So it has been a wonderful, wonderful service, and I have learned so much from the people in this room. And I'm so glad that I had the opportunity through Innovations in Aging to be a part of the commission. And just sharing the mission that I had for this seat is, let's get some people in these seats. Let's get some voices from these more rural municipalities who we haven't had those seats filled since I've been here. And it's not, I would say that it's not difficult, but it is a continuous process. And so if anybody has any questions, I'd be so happy to have a conversation with you. My goal between now and the end of this year is to find somebody to fill my seat as an appointment from the Colorado Springs City Council. So I've reached out to city council members in Colorado Springs. I reached out to individuals who I know in Colorado Springs who I think might be interested in joining, and connected with the group that is still doing some age-friendly work here in the city. I think that having somebody from the age-friendly Colorado Springs work groups would be magnificent, to find somebody who is already volunteering their time and to bring them into I don't know, the word that is coming to me is the administrative folds of this organization, but to give them, an opportunity to walk side by side with the work of those two different groups, I think would be absolutely fantastic. So if you know somebody who you think would be a good, and I'm looking straight at Jody, I'm like, who do you know, Jody? Jody knows, I'm going to laser in on everybody's eyeballs, but I know there's somebody in the city who is right for this role. And let's find them. Somebody who can work well with the city council, work well with this group, work well with Age Friendly Colorado Springs. And if you have any suggestions, feel free to email me, email Melissa, and let's get the ball rolling, because it'll take a little bit of time. And I would love for that person to be ready to rumble January 1st. Thank you.
Thank you, Erin, and thanks for all you've done to expand our membership. It's been fun to watch and exciting.
Thank you.
Yep, you've done wonderful.
And I would like to comment as well. All of the work. First, I want to just comment and help Kathy know that your first term expires at the end of this, but you're in for a second term. So for another 3 years. Anyway. So, and then also, Erin, thank you, because all of your hard work with the appointee process has also trickled over to the Regional Advisory Council and getting people appointed at the Regional Advisory Council as well. And I will, ditto your comments about just everyone is different. And it's been an interesting process to have our Commission on Aging and our RAC reaching out in such a way to get our elected officials to appoint people. So thank you. It's a good legacy to leave. Thank you.
Thank you so much. That means a lot to me to hear, and to hear that it's spilling over into the RAC as well.
Yep.
Awesome.
Yeah. Thanks.
All right, we will move on to item 6B, jurisdiction report updates.
Speaking of that, I don't know that any of our jurisdictions have any updates. This is the opportunity for people who have been appointed. If you have done any presentations or had any interactions with your county commissioners or city councilors, to give an update. But I don't know that we have anybody formally, although Erin, you might just reiterate a little bit about your stepping down from this city of Colorado Springs.
Yeah, just that the city of Colorado Springs is looking for a new appointee to the local Pikes Peak Commission on Aging. So, other than that, I don't have any updates from the city.
All right, we will move on to the policy committee. The first one being the Colorado Center for Aging.
I don't have any updates from that group this month.
Okay. Next, the Pikes Peak Area Council of Government Legislative Committee.
So those of you who are in the room, you can see Jared's not with us. We have Cheryl, our office manager, supporting us today. So that's great. Thank you very much, Cheryl. We appreciate you taking the time to be with us today. I will share a little bit of what's going on the legislative side. The committee is meeting monthly right now and has approved moving forward, as you know, with the white paper that you all created that was approved by the board of directors. Jared not being here is because he's in DC. He and our executive director, Andrew Gunning, are both in Washington, DC this week as part of the chamber fly-in, which is a great opportunity for them to visit with our state legislators. And so they're having a variety of meetings and listening sessions this week to make sure that the needs and priorities of the Pikes Peak region are being addressed and being highlighted. So that's all I have for right now. Just as a reminder, as we get closer to legislative season, those legislative subcommittee of the board of directors of PPACG will switch over to twice a month and then ultimately once a week as we get closer and into the legislative season. So that's what I'll leave with you today.
Great, thanks, Jody. Item D is the Colorado Commission on Aging. Penny.
Thanks, Paula. Unfortunately, we meet the day before the Commission on Aging. So what I'm going to do this time, rather than saying I don't know yet, is inform you of the agenda items that they will be going over tomorrow. And I think that will give some insight where the state is really focusing information right now. The updates in this particular time of uncertainty, both from the federal legislative perspective and also the budgetary state perspective and the special session, those will be the first items that will be that will be addressed tomorrow. And if there are particularly notable items that Jared wouldn't be getting through the legislative report, I will send those so that Melissa can send those out, because the uncertainty of the times is certainly a concern. And the budget update, we know that budgets both at the state level and at our local level are of a concern. And probably for those of us that work in the service area, it's probably important to maintain at least awareness of what is going on. I would like to, it's not particularly on the Commission of Aging, but locally on the 25th next week, we do have the State of the City, and it will be accessible virtually. And so I think that probably for all of us, that would be a good opportunity to sort of get an overview of where we are in our community. The other things that will be addressed tomorrow at the CCOA are the strategic planning session. And the council or the commission takes the year strategy session very specifically focused and are committed to really following the process. So once that happens in October, on October 16th, the direction for the State Commission on Aging will be set, and I certainly will be sharing those. The other notable thing that Erin has spoken frequently about is the multi-sector plan on aging. And if you recall, and I see Penny is online from Park County, they have expanded, they being the Colorado Commission on Aging, have expanded their work groups to align with the multi-sector plan on aging. And remember, the multi-sector plan is a 10-year plan. So the 3 existing work groups that are open to participation from anyone across the state are health, which currently or previously had a mental health focus, is now being expanded to the entire area of health. The workforce, currently the focus of the workforce is looking at workforce opportunities focusing on older workers. And then the policy group And during the realignment of the Commission on Aging, remember, Aaron was chair of the policy. Now, policy, because of its importance, is going to be included in each of the work groups. Age-friendly, and we have age-friendly work sort of re-energizing locally, is also a focus area. So in addition to age-friendly work group, an expanded health perspective, and workforce, the State Commission is adding 2 additional work groups, one on long-term services and support, and the other on the economic environment. So these will all be opportunities for us to actively be engaged at the state level. The other thing that I would like to alert you to is today, a little delayed on my part, I did send to Melissa the Health Equity for Older Adult report. It's about 146 pages, so it's not a quick read, but I think it is an important read to get a perspective of the state focus on health equity for older adults, and there are also breakouts for individual counties. So that report will be discussed tomorrow. And again, it might be something that we want to look at to focus on at some of our future meetings. So I think that is pretty much where the Colorado Commission on Aging will be focusing for the next month.
Thank you, Penny. I have 2 comments to share. First, I did bring, and it's a handout here today, the Colorado Commission on Aging is hosting in connection with Penny talking about the workforce group. They have a Help Shape the Future of Work for Older Coloradans listening sessions to hear from workforce people 50 and over. What are the challenges they're facing in the workforce? What do they want to see different? And so they have an in-person session in Denver, and then they have 3 other virtual sessions happening around the state. So I do have a copy of that here. And we'll re-forward that out to Commission on Aging members as well as a reminder to pass that on to folks who might want to sit in and either learn or actually contribute information from their perspective. And then the second thing, Jody has asked us to host a watch party for the State of the City for Colorado Springs here on the 25th. So we are hosting a watch party here. It starts at 7:45 and runs until about 10 o'clock. So I'll be sending out an invite for people to come for light breakfast, hang out, and participate in that. And then we go right into the RAC meeting at 10 o'clock. So people could make a little bit of a morning if they want to stick around and hear from the RAC. The Regional Advisory Council will actually have 2 of our providers who do vision services presenting, because October is Meet the Blind month. So we're hearing from our vision service people here with the Regional Advisory Council. So hopefully a few commissioners will want to come to that and have breakfast here. Thank you, Jody. So that will come out. Those were my 2 additions to your presentation.
Well, thank you, Melissa. And that reminded me, I forgot to note something. The commission, the State Commission on Aging also has been very actively announcing that September is Workforce Development Month, both acknowledged at the national level and also in Colorado. And there is 1 month or 1 week in the month that is designated as Older Worker Week. And so we were fortunate enough to have an opinion piece put in, or it was selected for the Gazette, acknowledging that within our community and the emphasis of older workers. So actively participating in building awareness.
Next, we have the PPACG Board of Directors items from Jody.
Thank you, Madam Chair. To carry on the theme of budgets, that is kind of where we are in this time of year with the Pikes Peak Area Council of Governments Board of Directors. It's the usual time of year that we're talking about budgets. We operate under PPACG. We operate on a January 1 fiscal year. And those of you who have had fun conversations with around budgets, AAA operates on a state fiscal year, and we have other funding that works on completely other fiscal years. So it's sometimes exciting around here when we talk about budgets and budget cycles and how they all work together. One of the big concerns, as you might imagine, is some of the recent news that we're starting to see around cuts made at the city level, cuts made within some of the communities in our region as well. It's very important to understand sometimes the connection between our municipalities and our counties with Pikes Peak Area Council of Governments, because we are a membership organization. And when the counties and cities and municipalities have to make cuts, there is a big concern of where we might fall within that, because that is how we provide the match to our federal and state grants, is through those dues. It's also how we're able to host a morning breakfast because our grants don't allow that kind of thing. And so we have to get a little creative sometimes with how our funding is managed in relation to the opportunities that we see in our region. And so that is a big part of the discussion right now at the board level overall, is not just our budgets, but also the budgets of our fellow municipalities and how they're operating and expectations around that. Of course, we're also seeing the continued conversations around legislative work. And as I mentioned in the previous information item, we do have Andrew and Jared in Washington, D.C. right now as part of their continued efforts to raise awareness of the Pikes Peak region. Some of the other area that is currently under discussion with board of directors continues to be programs. We recently hosted an annual, what we do annually is an in-depth workshop. And we were able to, as the various teams from across PPACG, provide updates within our programs, everything from funding and the type of programs that we do, and upcoming planning sessions and that kind of thing. So for us, along with kind of a mini PPAAA 101 of who we are and what we do and what kind of funding we receive, we talked about our funding, the challenges that we faced when the state needed us to cut back by 25% in case the federal funding did not come in at appropriate levels. I'm happy to share, and we shared this recently with the board as well. I'm happy to share that we were provided somewhat flat funding, but we did lose funding in our 26 allocation, our federal, primarily out of our federal funding, but in our 2026 allocation, which is the fiscal year we're operating in right now, we did lose funding. It was the equivalent of 1.73% of our overall allocation. So not a huge difference. However, every penny counts right now when we're talking about increases in the cost of services and delivery and material costs and that kind of thing. So we have since received a bit of carryover funding already placed within our allocation, which does bring us back up to a flat allocation compared to last year. So we've been able to make up that 1.73%, but it doesn't give us a whole lot of room to do more and to do what our community needs. And so we're very happy that Jared and Andy are out in DC bringing awareness to the programs that we provide. Within that, they also talked about transportation and military services and air and water quality services, and those are all the different programs that happen here throughout the Pikes Peak Area Council of Governments, and how we work together to make sure that funding comes in, not just for those programs, but ultimately to make the Pikes Peak region the great place it is to live. And so all of the board members who are, as you know, elected officials for their municipality are able to participate in the discussion and the planning to better projects for their municipality. So that's what I have for today for the PPACG board.
Great. Thanks, Jody.
You're welcome.
And for the chair report, I was not able to attend the senior center open house. So if someone could tell me how that was, I look forward to stopping by and checking it out.
Please do. This is Jody again. I'm going to jump in on that. As a former senior center director in the old building, I had a bit of jealousy going on through the day, but just kidding. There, really just amazing facility, new facility. The citizens of Colorado Springs should definitely get over there and take a tour. In fact, I was there today just for a little bit. It was hopping, every square inch just covered with people. And so they're estimating that they're already having around 300 people through the building every day. The meal program is coming back. It was a little challenging while they were spread out during the development and building phase, but they were serving lunch while I was there, and classes and groups are going strong and claiming their space. It's just a really, really beautiful and practical space, and I think really looking forward to seeing how they have the opportunity to make changes and expand the programming that they did previously. It's about 6,000 square feet larger than the previous building. They have 3 times the amount of parking. And it's just, they just did a beautiful job of the building itself, both inside and out, and very, very practical. So there's still a little bit of work to be done, especially out on the northern edge facing Caramillo and Patty Jewett Golf Course. They still have some work to do there, but it really is truly a beautiful place for folks to connect. Reduce that social isolation. David, if you haven't been over to Senior Center, I would highly recommend that you get over there and take a tour. It's just a beautiful location. But really, that's something that we were always so proud of, is that so many people came through, made connections, made lifelong connections. And it's just a beautiful way to enhance their older years. So just a beautiful spot. I encourage you to get over there.
So this is Kent Matthews. I was there for the grand opening, and this is a little bit of a jab to Jody based on part of what he envies is they've doubled the restroom space in the new facility. So rather than having 1 restroom per gender, they have 2 restrooms per gender. So that's a huge, huge step forward. I was over there this morning doing a presentation on finding purpose in aging through Pillar. And so Pillar and the Senior Center are working collaborative together. It just felt good to be back. I mean, even though it was a brand new building, it felt wonderful to have that one place where seniors can come. And you're right, it was hopping this morning. It was busy. It has a very very good feel to it. And I think everybody is just ecstatic to have it back and say, this is where we can go now. So yeah, I'm glad it's back.
I'll add to this. So September, in addition to being Workforce Development Month, is Senior Center Month, ironically enough. And so the Aging with Altitude podcast, we did interview Tom Lathrop on the grand opening and how what the excitement was around that. So Aging with Altitude podcast at Studio Radio 809. Anyway, so congratulations to them, and anybody else attended and want to make a comment.
Well, I can say that in 1987, I did my field work for my college and the Putman, and I knew every inch of that old senior center very well. And I have great memories and history with that senior center. So I'm excited to see the new one. Wanda, did you have something to add?
I was just going to add that it was very heartwarming to see the reception. I was like, wow, there's a lot of people here. I saw a lot of people that go to the Fountain Senior Center. They were there in attendance. So that was cool to see, and they were super excited. And it is a beautiful facility. I haven't been back since the opening, but it was really heartwarming to see for our city. So.
Yeah, and Wanda was at our table. They did resource tables, kind of information fair throughout the building. Wanda got to join us. We had a couple of staff members there. Kent was there. So yeah, I hate making lists because you lose something. So, but just a lot of great conversation with folks coming through and excited to see us still engaged as PPAAA engaged with the senior center. But it was really just, to Kent's point, just so good to see so many people in the same spot. And there's a high level of ownership. That's something that we experienced when I was on staff, and it really is good to see that people excited to be back in that area. And yes, until you've worked an 8 or 9 or 10-hour day with only one pair of bathrooms, you can never understand how exciting it is to have 2 pair of bathrooms. Just saying.
All right. On that note, we will move into our presentations. And first up, we have the PACE community update.
And I'll introduce while she's coming up to the stage. So we have Dayton Romero, our commission member who's not with us today. He helped to connect us with Andy McDonough, who is the Vice President of External Relations with PACE. And we're happy to have her here today and sharing a little bit about some of the work they're doing in the community, and possibly sharing with our commissioners any extra help that you might want from our commissioners, and kind of going from there. So welcome, Andy.
Hi, everybody. I am really excited to be here. Melissa, how do I do the PowerPoint? Okay. That sounds great. Thanks to Dayton for connecting us. And Melissa and I did touch base prior to me coming to see what we thought might be the most beneficial for this group, and thought it would behoove us to start a little bit with, again, a PACE overview and the comprehensive and complex services that they provide, the impact of HR1 and the regulatory burdens that are going on right now, as well as advocacy and some of the major challenges that we're seeing. And in listening to some of the discussion that was going on earlier, I'm not surprised that you're already talking about a lot of the things that we are currently seeing. I don't have my glasses on. This is bad. Just with regard for basically who is PACE. PACE is a program for all-inclusive care of the elderly. I opened the wrong one. Okay. I am so sorry. Um,
You can also see it at this screen.
you, oh, that's lovely. So.
You can see that.
So yeah, it's program of all-inclusive care of the elderly, and we really treat all participants that have medically, functionally, and cognitively complex needs. They all meet nursing home level of care. So Rocky Mountain PACES and all PACE program goals are to really support and help our older adults age in the community and in the homes where they reside. It's considered a home-based alternative to nursing homes, which I think we can probably all agree would be a better option whenever possible. The really comprehensive thing about the PACE program is that we are looking at not only the medical, but the physical, social, and emotional components of the care that we provide. So really holistic, person-centered care. We provide services through our interdisciplinary team, and we're going to talk a little bit more about that in just a second. But PACE programs are a healthcare, so the insurer, as well as the provider of services. It's typically a three-way agreement between CMS, the state, administering agency, which in the state of Colorado is HCPF, and the PACE organization. CMS writes the rules, HCPF administers the rules, and hopefully the PACE organizations follow the rules. Normally our participants are 55 years. You have to be 55 years or older to join PACE, but they go up to over 100 years old. Our average age is 75, with 68% being female. We have 3 sites in Colorado Springs. We just opened our 3rd site in Southwest Colorado Springs. Our goal really is to strategically place our PACE centers in the core neighborhoods where our participants come from, because we don't want them on our transportation for too long, and we really want to encourage them to come into the center, because the more often we have our eyes on our participants, the more successful we'll be in being able to address their concerns and their needs. The next slide is really just a summary of some of the services, the comprehensiveness of the services that PACE provides. It's really hard to list it all. It's probably easier to say what we don't do. The minimum is Medicare and Medicaid covered services, and anything that the interdisciplinary team identifies to promote the health and wellness of our participants. So we really have the ability to be creative, flexible, and do things outside the box than what a traditional healthcare program can do. The interdisciplinary team is core to making sure we are providing these services. It's a regulatory requirement that these 11 disciplines have to be present in order to take care of our participants. Rocky Mountain has 6 interdisciplinary teams. Each one has 17 or more people who meet every day to talk about the participants that they serve, who are designated to their panel or to that specific interdisciplinary team. So constant looking at hospitalizations, emergency rooms, falls, incidents, upcoming procedures, any of the things that our participants are needing or asking for. This next slide is really just a snapshot of some of the things that we do. And so we have some numbers here that indicate some of the services that we provide. I do want to just highlight the 250,000 separate encounters that our participants see. So this number was actually from last year's data, and it was probably, we have about 1,095 participants now. Back then, it was probably 1,065. So that equates to like 234 visits or touches or encounters for each of our participants every year. And so that is unique to most healthcare plans. Of course, that's the average, and some participants use a lot more and some use a lot less. And then with that Rocky Mountain PACE, we have the 460 associates that provide all of these services. I want to highlight the 34 contracted residential care facilities that we contract with and the 117 medical specialists that we contract with. Basically, a PACE program has to be contracted with and be able to provide any of the services that one of our participants will need. And so if it's not locally, we've got to go out and find out where we can send them or take them to for that service. So we're pretty proud of that number, and it's really what allows us to keep our participants at home and living in the community where they reside. I do just want to say that we have about 9% of our participants that have transitioned into long-term care. And so that means about 1,000 of our participants remain in the community or assisted living, because assisted living in the state of Colorado is considered community living. I heard it said earlier that it's uncertain times and things are complicated right now with regard to the federal changes that are going on. And one of the areas that Dayton had suggested that I touch on was the impact of the HR 1 bill on the PACE programs. And so fortunately, we're optimistic, guardedly optimistic for the PACE program that we're in a good place to navigate these changes. The feedback that we've had from our state and national advocacy groups has been that there's anticipated minimal direct impact to the PACE program because a lot of the long-term care waivers, the HCBS waivers aren't as dramatically impacted as the traditional Medicare programs. That, again, we're guardedly optimistic. We anticipate that we will have a reimbursement reduction. We do not know what that is yet. It is still being adjusted, and we'll know when they let us know what that is. And so we are pretty certain that will happen. And where that becomes challenging will come into effect a couple slides from now. But then we also don't know how this can affect our state oversight. Right now, we have a truly amazing relationship with our state administering agent and our partners at the state, as well as our partners at HCPF. So really don't know if there'll be any realignment, any staffing changes, anything along those lines at the state level. So again, right now, I'm optimistic, but remains to be seen how things will roll out. I'm not sure. I'm assuming a lot of people attended the webinar from the executive director of HCPF and sounded like she wanted to spread the challenge across all areas versus having any majorly hit. So hopefully that will prove to be a positive thing. The major challenges that I think as Rocky Mountain PACE and PACE organizations we see, and this is not in isolation to PACE, it goes across all areas, are really these things on this slide. The top two are probably my most concerning areas and front and center on my mind are the housing vulnerability and the cost of living. Right now, Rocky Mountain PACE, which was not intended to be a housing agency, probably pays about $2 million a month for our participants who are in ALF and long-term care. And so only more people are joining in ALF and then transitioning to long-term care. And so any reimbursement changes that happen impact our ability to continue to sustain that, as well as to continue to provide that comprehensive service list that I had shared earlier. By regulation, we have to continue to do it. So it's going to be interesting to see how we continue to do all of that. We have 34 assisted living and memory care and long-term care contracted facilities. We're at their mercy, and that's why I say it's our Achilles heel, because at any given moment, they can decide they no longer want to contract with PACE. Takes a new leader, a new owner, or an organization that just determines they want to accept private pay residents only. And so that's what keeps me up at night, is making sure that we've got placement for our participants that need that level of care. The same thing is probably not as dramatically, but the same thing applies to the medical specialist. They don't have to contract with PACE, but it still is PACE's responsibility to provide whatever service our participants need. And so they may not take PACE, they may take a limited number of PACE, and with that comes a lot of times for some of the harder to come by specialists, a long waiting list or delay in getting appointments scheduled. I did want to just share one example that we're currently facing right now is in Colorado Springs, there's one rheumatologist. So they want 115% of CMS reimbursement. We get paid less than Medicaid. And so as outside organizations continue to request and base whether or not they want to work with us on what we can reimburse, it's going to become more challenging as time goes on. You'd already mentioned mental health, and I'm glad to hear about the mental health program going on and that is expanding. It's well known that there are limitations in that area. And so 86% of our participants, so again, we have almost 2,000, 86% have one or more mental health diagnoses. Some of them have up to 6 or 7. And so this is from a psychiatry, a neuropsych, a inpatient treatment center, as well as facilities, ALs and long-term care, who are able to provide that level of care and will accept people with mental health challenges is very limited. And so again, that's what keeps me up at night. And then as far as the administrative burden goes with regulations, PACE is a very highly regulated organization. The regulations keep getting tougher and they are harder to do effectively and efficiently. And so as reimbursement decreases and regulations increase, it's just going to be a very interesting outcome of how we maneuver that and continue to do what we do. So our plan, we really need to continue to promote the holistic and individualized care that we provide and hopefully achieve the quality outcomes that we do. I think advanced care planning and what matters most to our participants is probably a key area. I think in America, and I'm making, this is very stereotypical, I will own that right up front, but in America, it's about live longer, do everything that you can in order to live longer. It doesn't always talk about what matters most and what quality is, and what does that look like to each and every participant at Rocky Mountain. And so we need to do better in digging deeper into those conversations in order to make sure that we're doing what our participants want, what they need. We have to do better to reduce our hospitalizations, our ED visits, our subacute stays, our long-term care. Again, I think we're pretty good with regard to our participants who are in long-term care, but we need to use the supportive services of Rocky Mountain that can keep our people at home longer so we can minimize that as well. I talked about the facilities and the medical specialists. We are trying to do what's appropriate when it comes to employing the medical specialists that we can afford to employ. So it's great to be able to share that we have counselors on staff, we have a pharmacist on staff, we have a psychiatrist that's on staff for 1 day a week, we have a dental hygienist, we have a dentist, we're hoping to get another dentist. We just bought 10 new vehicles because we want to bring as much of our transportation in as possible. But that was honestly, probably initiated because of the challenges with MedRide, but it's making us do it better and more effectively. So those are the kind of things we need to keep doing. But again, it's also going to come down to reimbursement and our ability to continue to do that. So we need to be nimbler and more efficient in how and what we do and focus on influencing policy and reducing regulatory barriers. We are really trying to be more present in the community, to tell people about PACE, to share the PACE story, to help people learn about the PACE model of care, because we honestly believe it's a best kept secret. And I'm actually presenting at the Senior Expo on Saturday about the best kept secret because people don't know about PACE. And so, and all of the care that can be provided. And so this list is just our most recent attempt at reaching out to community members and our legislators and people who we hope can influence policy and regulation and become as passionate as me and all of the people in this room about the care in our state. And so I think, Melissa, you had wanted to know, because when we talked about me coming in August, it was right before we were hosting Senator Hickenlooper. Well, and we had also requested that Bennett and Crank come, and Hickenlooper's staff came. So we had 3 representatives from his office, which they were very interested and welcoming and wanting information on the PACE model of care. With regard to kind of the message that we are promoting, so I've gone through most of these. This is mostly a summary, I'd say. But the thing that I want to point out, which doesn't make any sense for the PACE model of care not to be supported, is we're risk-based. We only succeed if our participants succeed. And so all PACE reimbursement is at less than Medicaid rates. So in reality, we save the state and the taxpayers money. And so that is, and provide a proven quality model of care. And so that is pretty much my spiel. Melissa said you guys always ask for how can you help, and I heard that before, and so I really struggled with coming up with how you might help. And so the first 2 bullet points I put up here are very PACE specific. So if you have any input for me and or ideas and or networking opportunities you think would be appropriate, please, I would love your feedback. And then as you are out doing the work that you do in the areas, if the PACE model of care fits into some of the things you're working on and or advocating or again, reviewing legislation on it, would love for you to keep that in the back of your mind. The last 2 I already knew you were doing, but it was really white space and I couldn't have white space. So I put a couple of extra things on there. So
I have a question. Are you nonprofit?
Yeah.
Yeah. And so most of the money you get for your staff and programming is from foundations and donations?
No, it is actually, most of our participants are dual eligible. So we receive a capitated rate from CMS and a capitated rate from the state in order to provide all of the services.
Okay. And that includes paying your staff?
Yeah.
Okay. Yeah. And my other question is how is your staff trained?
How are we have a comprehensive onboarding orientation program. We have a list that is of competencies that are required by the state of Colorado to make sure that we're competent to work with the aging older adult. And then all of the professional disciplines, of course, have to meet their competencies and education requirements for their degrees and certifications. We have ongoing education throughout the year on different topics. Every year we have an annual competency review on high risk, low frequency, annual lists of topics that typically need to be reviewed. And I think that I probably missed something, but thank you.
Andy, regarding your staff, it seems that on a pretty regular basis, you guys are winners of kind of the happy workforce place.
Yeah.
Can you comment on that a little bit? Speaking of staff training, and just comment on that a little bit.
Sure, I'd love to. honestly, the culture at Rocky Mountain PACE starts from the top down, and that is the vision of our CEO, is that, if we take care of our people, and our people being participants as well as our associates, that all of the other metrics and dynamics and things that we need to do are going to fall into place. And so we are regularly looking at engagement and opportunities and pay and listening and having State of the Unions and Q&As and regular communication to try not to have secrets and not holding back and really wanting to find the right people who have the same mission that the majority of us now have at Rocky Mountain PACE, to that they align with that when they onboard, and hope that it's the last place that they want to work. So culture. I could have just said that, probably.
Hi, I'm Erin Marizella, and I used to cover from Pennsylvania to Florida, and I would go to senior living facilities and care facilities and do endoscopy. And when I was in I was living in North Carolina before I started doing this work in Durham, and a PACE facility opened, and patient family members were telling me that it was changing their lives to have PACE in their community. And I thought, what is this thing? And then when I was traveling, covering the whole Eastern Seaboard, the PACE employees were the happiest people. The nurses, the nursing staff, the CNAs, the therapy team, it was fascinating. And so I know that you are doing a good job, but also I feel just like there's something about PACE that is good for humans, whether you're the patient or the caregiver. And I just, building off of what Melissa said, I am so happy to hear that staff are so happy, and I know that it's part of the culture. And I know that you're all independent, right?
Yeah.
I mean, I believe so.
Yes.
You're all independent.
Yeah.
You guys-
Very far and few of independent PACE centers across the United States.
Oh.
So most are aligned with either a hospice or a hospital or a bigger medical model.
Oh, but you're not all one like entity.
Not
Right?
the PACE organizations in Colorado, no. We right now we are kind of by area. Just about a year or so ago, they introduced competition and allowed other PACE organizations to move into areas that were previously other, or like, El Paso County being Rocky Mountain, Denver and Pueblo being Innovage, et cetera. But so now I think we have 3 in Denver. And so there's 6 organizations in Colorado, 5 are nonprofit, 1 is for profit.
Okay.
And
Yeah. So thank you for the work that you're doing.
Thank you.
I hear it too in Colorado Springs that people are happy with the services that you provide, the work.
Thank you. It is, I will just say that, so I was working a grievance for one of our participants that they had with an emergency room here. And I called him and I'm trying to get information and I'm talking with him and finding out more details. And he was so amazed that I'd called him like 2 or 3 times. And his comment to me keeps me going is, you made my life great again. And I'm like, how can that not be amazing? And so I think one of the other, kind of going back to Melissa with regard to the staff, is healthcare turnover is still so high. I mean, in facilities, it can be 75 to 100%. And so we are about 25 to 30% turnover. So our folks tend to stay. And so again, I've been there 7 years, and so is our CEO. And so I really have to attribute a lot of that to the culture and to the work that we do. And I say 90% of our participants are amazing, super grateful, and wonderful. The other 10, not so much. I'll leave it at that. Any other questions from you all?
So this is Kent Matthews. It's not necessarily a question, but more of a statement. So when you said the push is to live longer, all of that kind of a thing, the thought that crossed my mind is, the push is there to live longer, but there's an unwillingness to pay the physical, mental, and financial costs of living longer. We don't have a realistic point of view of what aging really is. And so because of that, there's this drumbeat of live longer, assuming that we're all going to die well. but we don't have no idea in terms of the physical, mental, and emotional decline that often comes with aging and the costs that are associated with that across the board.
Mm-hmm.
Whether it's PACE, whether it's healthcare, doesn't matter, which is why we all are having those discussions right now in terms of what are we doing about budgetary cuts and everything else. It just shows the unwillingness to deal with how we properly age.
I would add to that, at least from the PACE lens, is that I think there's such a concern over liability that providers are do this test, do this procedure, do this specialist, and a better question may be, what does matter most to you? What's quality mean to you, and what would it look like for you to get there? And then you might still do all of that because it might be appropriate, but you might, in some people, cut out 50% of it, and others you might be like, no, I'm happy just the way I am, and I've done what I want to do. I'm where I want to be at, and I just want to be comfortable. And so it's just a conundrum. I probably forgot 3/4 of what I wanted to say. I will say that, but hopefully that was helpful. And again, thanks for having me. And if there's any suggestions on what we can do, please let me know. Melissa got my number.
Thank you so much. And I want to just acknowledge Dayton has joined us. And Dayton, did you have anything else to say or offer up?
Thank you, Paula. Sorry, I was not able to unmute, but I just caught the tail end of it. I apologize, I can't be there in person, but just such an honor to have Rocky Mountain Healthcare PACE in our community. They truly set the standard across so many areas, caring for their staff, talking about participants. I have the privilege of being in the boardroom, and the amount of times that I hear not only putting the staff first and second, but also the participants are always a part of the equation and decisions. It really is encouraging. And I know that they are even influencing other PACEs outside of our community. So with Andy's leadership and the executive leadership team in PACE, we're just very fortunate in our community to have such an amazing organization. So thank you, Andy, for taking the time. And it sounded like a really rich discussion. And again, apologies for missing.
Thanks, Dayton.
Great. Thank you so much.
While Erin gets ready for her presentation, I just want to also acknowledge Laura Cronick has joined our meeting. As you know, she is a member of our Regional Advisory Council and also a member of the Monument City Council. So just thank you. Wanted to thank you, Laura, for joining us today.
And Penny from Park County snuck in a while back and we forgot to acknowledge her. So Penny, thanks for joining us from afar. Always appreciated. All right. Our next item is Erin Marizella Mozzarella presenting on ageism and language from the Changing the Narrative.
And I need to request for slides to be advanced, right? Or do I have control? Oh, okay. Okay. Thank you. So I'm Erin Marizella. I live in Colorado Springs. I work very closely with Changing the Narrative, which is based in Denver. Has anybody in this room not heard of Changing the Narrative before? Is this a new organization for you? Anybody else? Any new people? Have you heard of it? No. So Changing the Narrative was built in Denver by a woman named Janine Vanderberg, and she built it to fight against ageism, against age bias. And before they kind of shifted their business in the past couple of years, they operated in every state in the country, and I can't name how many other countries around the world. They've had an incredible impact in the way that people think about ageism and age bias in relation to ourselves and the communities that we live in. And I feel very fortunate to have learned how to speak about ageism from Janine and from the work of Changing the Narrative. It's very well respected. I hear people talk about it all over the country in the work that I do. And someone was asking me this weekend or this week, I was at a conference and they were like, why, why are you doing this? Why do you speak about this kind of stuff? And really and truly, I think, it is passion and it is, just the chance of my career and where I got to, but also it's the environment that I'm in and the fact that I have been surrounded by an incredible network of age positive change makers. And I have the tools and I have the skills, and I am so I want to give all the flowers to Janine and everyone who's part of the Changing the Narrative movement, because I couldn't do it without the people who laid the groundwork before me. So next slide, please. What we'll cover in our time together, I want to talk about ageism and age bias a little bit, how age bias influences systems, what works in combating ageism, and I use the research from the World Health Organization. So they have a pretty strategic plan for combating ageism and age bias, and what is the next right thing that we can do as a group at the Commission on Aging. And before we get started, I just want to say that I use ageism and age bias interchangeably. And I want to just take a moment to acknowledge that bias is a human trait. It is cognitive. It's built into the way that we operate. It's the way that we think. Bias in general is neither positive nor negative. Like, I have a bias for walking into a dark cave in the middle of the woods alone in mountain lion country. And I think that that is a good bias that keeps me alive. We make good choices. I wear my seatbelt when I drive. There's a lot of stuff that we do because we know from experience, this is something that will keep me alive. This is something that will keep me safe. And what we try to do in change making work against any kind of bias is acknowledge it. It's neither positive nor negative. It just is. And so what we need to do with ageism is we need to look at it and hold it up and ask ourselves if this is a barrier to what we're trying to do. And maybe it is, and maybe it's not, for us personally and in the work that we do in community. So with that being said, let's move right along to the next slide. What is ageism? So next slide. So what is ageism? According to the World Health Organization, ageism is prejudice, how we feel, stereotyping, how we think, and discrimination, how we act based on age. It's not for older people. It's not for younger people. The wonderful thing about this bias is that it's for everybody. So we have biases about young people as well. And I'm sure that we've all heard things about like, who's this 20-year-old kid coming in here and thinking he can XYZ, right? Or but when we talk about generations, which are not scientifically accurate, generations are not actually a thing. If we look at sociological research studies, we say, Gen Z, they're like this in the workforce, and, millennials are like this. Someone was saying something derogatory about millennials recently, and technically, according to pop science, I'm a millennial. And they were talking about the young kids, and I'm like, well, I'm 44. So I'm thinking like, is that me? I don't know. Am I a young kid? Am I like this? And, I've been in the workforce for over 20 years now. So it was related to how millennials act in the workforce and how we're so young that we don't know what it's like to have a job. And I was like, well, there it is. Ageism for younger people, right? Or against younger people for older people. It does not really matter how old or young you are. We're all a target for ageism. Next slide, please. So there are 3 types of ageism. There's 3 ways to think about it. And they are internalized, so how we feel about ourselves, interpersonal, how we feel about other people, and institutional, so what it is like to live within a system that has barriers or guardrails or support systems according to age without considering other pieces of our humanity. So internalized ageism is what we tell ourselves about ourselves. We think, I'm too old, too young, I'm too old to learn, I'm too old to do, I'm too old to start, I'm too young to learn, I'm too young to start. And there's research from a woman named Dr. Becca Levy, and her studies have shown that people who have a negative internalized view of their own age and they think that being older is worse for them, they die 7 years earlier than people who have a positive outlook on aging. And I worked for 15 years in geriatrics and healthcare, and it is not, totally anecdotal, but it feels true to me that people who believe that when you get older, you're sicker, tend to anticipate decline. They tend to remove themselves from social engagements that are so important for our mental and physical health. And it's true that we are what we become, that we sort of manifest our own aging reality. When we say things like, oh, I'm having a senior moment, or I don't even know how to use this computer, good thing that there are younger people here because I'm so old, I can't do it. That is a demonstration of internalized ageism. Or this one is very salient to me, that, oh, my knee hurts. Well, it's just because I'm getting older. And I think it's Ashton Applewhite says that she went to the doctor and her doctor said that she had a bad knee because she was older. And she was like, well, I have 2 knees and only one of them is bad. So that's not actually good evidence that it's because of my age. Next slide, please. So interpersonal ageism is what we put onto others. And although it's what we put onto others, it often is reflected in the way that we feel about ourselves. We can tell a lot about, it's like projecting what you feel about aging. You put it onto other people as well. So, we say, instead of I'm too old to learn, we say, well, George is too old to learn. George is too old to learn new software. And I see this all the time in work that I do in tech and in digital access for older adults. I see with my eyes that it is not your age that keeps you from being able to use technology. A lot of times it's poverty. There are affordable housing communities in Colorado where people are literally 50 years old, and they don't have an email address. They've never owned a computer. They've never used the internet meaningfully in their life because, who knows why? They didn't have a home that had technology. They didn't have access to getting to a library. They didn't work in a job that required them to have a computer. Like I am 44. These people are 6 years older than me, and these humans in our community have never used technology. It's not about age. There are people in their 90s using AI for fun, for play, right? So it's truly not about age, but we think that it is, and that keeps us from introducing technology to older adults in a way that is meaningful for them. It is very impactful in the workforce. We say we're not going to hire people who are 65 because they're just going to quit. And when we look at the data, it's actually younger people who don't stay as long. That's another thing. And I'm not trying to turn this into older versus younger. And of course, the doctors who tell Ashton Applewhite that her knee hurts. I had a sore knee after I hiked across Spain in the year 2011 when I was 29 years old. And my doctor told me it was because I was old. And I was like, well, I'm 29, so that might not be it. And then he said it's because I was a woman. And I was like, oh man, I need a new doctor. So it's not because of your age. It's not, and like, yes, our bodies do change as we age, right? But when we assume and when we tell people your knee hurts because you're old, we can miss a lot of things. And we don't have appropriate research for older adults because we don't research well, because we just think, oh, well, you're older, so we're just not going to deal with that. Next slide, please. So institutional ageism, the reality is that once you learn about ageism, once you know what ageism is, you see it everywhere. It is everywhere. And you can't unsee it once you see it. So, like, name a government system. I work with governments across the country, and I'll talk to a transportation department, and they'll say, well, we don't do aging here in the transportation department. I'm like, oh, for the love of God, like, if you think that you don't do aging, you're just not doing it well, because you are doing aging, because there are people who are aging throughout your transportation system, because we're all aging. And so if you think you don't do it, then you're not doing it well. Academic systems as well. We presume, and it might actually be different. I hate to say that we presume that college is for humans of a certain age. I've seen some really great changes in the time, and I don't work closely in the university system. I do think that University of Colorado, Colorado Springs is a really excellent example of a university system that does intergenerational and age-friendly education system really well. One of the reasons is that we have a lot of people retire from the military and then go back to school, and some of those people come to Colorado Springs for school, and so we have a better image. It's not like, what is that movie with Jim Belushi from like the 70s where he wears the college t-shirt and it's just all the kids in college, right? And he's like 30 and he hasn't left college yet and he's the only person who's still in college. It's not like that today. Name an industry, right? In tech, if you're over 30, you stop getting promoted. You are not invited to innovation meetings anymore. It's a huge problem in a lot of different industries. And name an identity as well. Like, we all carry a lot of different identities. So it's not just about our age. What does it mean to be a 30-year-old woman versus a 40-year-old woman versus a 50-year-old woman? What does it mean to be an immigrant as a 20-year-old man or an 80-year-old man? So the other identities that we carry with us also interact with our age and the age bias that can limit our opportunities when we're coming into to contact with different organizations. Next slide, please. So an example of a system, my work is, I say it's large systems architecture. So I work with academia, industry, and government, and I help build sustainable solutions for aging. So for growing older, if you want to stay in your home, what's the research? Who's the industry that can build this home? And what's the government policy that makes it possible for us to put a home here where you can grow older well? And when there is ageism, creating barriers to that kind of progress in a system, we see things like less support for age-friendly policies and systems. We talk a lot about age-friendly here in this room and in Colorado Springs. And usually what we mean, like Penny was talking about age-friendly at the Colorado Commission on Aging, we talk often about age-friendly communities here. And we say age-friendly to mean that, but there's a lot of different systems that have an age-friendly lens. And there is research from AARP and from the World Health Organization to show that when communities are age-friendly, we have better policies, we have better systems that people can age through. We get less funding for older adult programs due to ageist beliefs about who possibly deserves money and who is contributing to the economy. And, so no comment about like the funding, the like streams that are coming from the federal government right now. I don't want to make it seem like I'm trying to make like a backhanded comment about the federal government and changes in funding for older adults. It's not just that. We have lower funding in general for a bias that we have against any group of individuals, and older adults is just one example of there's probably some ageism baked into those decisions. There's a $63 billion annual healthcare cost to ageism in the healthcare system, and workplace age discrimination costs the economy $850 billion a year. So that feels like some money that we could have right now in the current moment. If we could figure out a way to include older adults in the workplace in a way that is impactful for our communities. So next slide, please. What works in combating ageism? Next slide. Sometimes stories that we think are helpful are not actually helpful. Stories like super seniors is not helpful. What stories of super seniors can do, like, for example, and, I'm going to call this out because I will never be not impressed by this. Did we have a 90-year-old pole vaulter at the Senior Olympics this year? Was she 90? Him? He was 90? Okay, 90 years old, pole vaulting in the Senior Olympics. I love that story, and I share it all the time. And if we say, look at this super senior doing, climbing a mountain, being a pole vaulter, starting a company at 90 years old. That's awesome. It's awesome for any human to do it. And I will never be a 90-year-old pole vaulter because I am not a 44-year-old pole altar. So it's not about what that person is doing because they're 90. It's about what they're doing because it's been their life. And it can make people think that it's not accessible for them, that they think, oh, that I'll never be that. It creates this kind of breakage in people's psychology where they think, well, I'm not good enough to do that. The reality is, if I'd started pole vaulting when I was 10, I probably could be a 90-year-old pole vaulter. That is just not my path. Another story that is not helpful is this idea of the silver tsunami. For one thing, the word silver is a little bit, there are some communities that don't like that as a word that we use to talk about older adults. But also it creates this negative idea that like, oh, here they come. Here they come. It's going to be a problem. There's so many of them. Oh my God, it's like locusts. Like here comes the silver tsunami. It's not a helpful way to frame our aging community. It creates a sense of urgency and crisis that sometimes makes people freeze, and it makes people feel, I mean, what can I do against a tsunami? Like an actual tsunami, what can I do as a person? Literally nothing. And so it is more helpful to talk about the reality of demographic change, the reality that, yes, we do have a lot of older adults, but also last year we had a lot of 63-year-olds. And before that, we had a lot of 62-year-olds. And before that, we had a lot of 60-year-olds. No one was like, oh my God, here comes the baby tsunami. Oh, gross, what's going to happen? When baby boomers were being born, right? And so there are needs and opportunities no matter how many people we have in any age group. I'm going to jump to the last one, the compassionate ageism, and then I'll go back to this one right before. So compassionate ageism is when we say things like our elders, or we hear this a lot in healthcare. I don't know if anybody has been a healthcare worker, but when we sort of infantilize older adults, like they're cute and weak and small, and we got to go help the old people that live in our community, it removes agency from those individuals. And when I worked in healthcare, I was absolutely a frequent compassionate ageismer oftentimes. And when I worked in healthcare, there were people who would say, call me grandpa. I want you to call me grandpa. Like, I am trained now not to do that to every man who is the age of my grandfather, right? Also, I respect the fact that this man wants to be called grandpa, so it is okay. Like, we give people what they need, but we cannot assume that everybody wants to be treated and coddled that way just because they're older. And it's benevolent, it's kind, it comes from a good place. And the reality is that not everybody wants to feel that way. It can remove people from their strength and from their ability and from what they really can do on their own. So we just kind of have to listen and learn and see how people would like to be, how they would like to be approached, how they would like to be treated. This last one, in the Changing the Narrative community, we have said, and I was trained, that we don't say that ageism is the last acceptable bias, because there's still a lot of sexism, there's still a lot of racism, there's still a lot of ableist bias. There are a lot of things that we are still working on. And recently, I have a friend and a leader in the aging community. Her name is Barbara Brooks. She lives in Denver. And she is a Black woman, and she is saying, yes, ageism is different because, and I do agree with her on this measure, because I feel very comfortable if someone says something racist or sexist, like a stranger or a friend, if they say it, I feel comfortable being like, hey, now, like, let's not do that. Let's not talk like that. And I can't do that with ageism almost ever. If someone says something ageist, and even if I know them really well and I'm like, hey, that's kind of not cool. People have not started to, I call it peel the onion, but they have not started to like think about ageism. People don't know that it's a thing. And people have a negative reaction at like, there's almost no way to come up to a stranger and say, what you said was kind of ageist. It's just like they black out. And so I do think that because it's something newer that we've just started to talk about more in community in the past, I don't know, 30-ish years. I probably shouldn't try to put a number on it. I'm pulling that straight out of this empty hat down here. But it is a little bit different. I can't be as direct about ageism. And having this out here and saying, sometimes these stories aren't helpful. These are the things that we should do. This like best practice. I fumble this all of the time. I fumble ageism all of the time. I'll be in rooms and board meetings with people I don't know. And I hear ageist comments and ageist jokes and I just kind of chuckle along because everybody's chuckling, or, I say stuff. I mean, I say, oh my gosh, I wake up in the morning, I'm like, look at my face. I'm getting so old. I'm so wrinkly, out loud to other people. And no one is perfect. We've lived with this for a long time. We are all in this together. We are all moving forward together. And what I would love to see for this commission and for Colorado Springs and the work that we do with age-friendly community in Colorado Springs is to create a safe space where we can learn with this together. Because I do have a network of change makers against age bias across the country and honestly the world, because it's a kind of a small community and we're really closely knit. And we will like send each other little notes or like pull someone aside after and be like, hey, can we talk about this thing that you said? Like maybe we could say it a little bit differently next time. It made me kind of feel this way. And because we have this trust and this open conversation, I feel like we're really moving forward well together. And when Barbara Brooks in Denver, she's like, no, I do want to say that ageism is different. That ageism is the last thing that we need to, like this mountain that we need to climb differently. There was a conversation in the community like, okay, are we going to change the way that we talk about this? And I love it because, we're all fumbling and we're getting through it together. Next slide, please. So research again from the World Health Organization shows that these three things are effective in combating age bias across the world. These are the three things that are very, very good. They're very proactive and they truly create evidence-based, data-backed change. One is policy and law, which is why I have loved working in this group and why I'm a big fan of the Colorado Commission on Aging. When you put it into policy and law, that stuff is set in stone for a while and it influences all kinds of different change down the road. It's like planting a tree and it just continues to grow. Another is educational activities, which is why I love the ageism training when I have the opportunity to work on it, is because we don't know about it. So like, if you don't know it, you can't do it. If you don't, when you know better, you do better. And so educational activities, just talking very openly about what is ageism is important and it's impactful and it's effective. I wish that I need to check in with Janine Vanderberg about this group that presented to Changing the Narrative in 2023. They were doing a survey of internalized ageism. And it was a coffee chat with members of the Changing the Narrative community in Colorado. And they did the survey. We did it like in real time and they pulled the results up. And the women said, we have never seen results like this before, because across the board, our survey showed that we had very age positive self-awareness for everyone who was on the call. And it was like 75 people. And that is directly related to the education that we were receiving from Changing the Narrative. So I can tell even from that one moment that education really works. And the last thing is intergenerational interventions. So there are things that are multi-generational and there are things that are intergenerational. And multi-generational just happens. It's when you're on the bus and you just happen to be on the bus with people who are 20, 30, 40, 50, 60, 70. It's like there are multiple generations here. Intergenerational is intention. So intergenerational is when you say, we are going to make sure that the bus is accessible for people of all ages, and we are going to encourage and create a positive transit environment for no matter how old you are. And when we talk to people in different countries about ageism work, it's interesting because in the US, we have a high need for intergenerational design. We have a high need to make sure that people from different generations are present together because we don't do it as much. And sometimes when we're talking to like Japan, for example, and we ask questions like, how do you build a community center where people of different generations can come together? They're like, is there another way to build a community center? I don't understand the question. So it's making sure, like, it's looking around the room. We talk about setting the table. Like, do we have enough diversity at the table? Do we have enough voices of different ages at the table? And if we don't, why not? And if we don't, what can we do to improve that? And both directions, right? I mean, Penny does such a fantastic job at JAWS about making sure that we have, high school students and college students in this room, like seeing what's happening and what's going on. So it needs to be both ways. I like to just say that, we should all have access to the door unless we're 2 years old. And then maybe I can tell you whether or not you can like play with scissors and stuff. But everybody, no matter how old you are, we should be able to have access to community. Next slide, please. So how can we move forward together here? There is a Harvard University has an implicit bias test that's really cool. And you can Google it, it'll come up. You can select from a bunch of different biases. There's one for age, there's one for disability, there's one for gender. I think there's like 20 or 30. I took it recently. And you can take the one on age and it'll kind of show you, like, for your community and for yourself, how you're feeling about ageism. There's also an ageism scale that the World Health Organization released this summer. That's super cool. And I've put one together for our group if people want to take it. I really recommend reading Dr. Becca Levy's Breaking the Age Code, Ashton Applewhite's This Chair Rocks, and Karen Walren's The Light Maker's Manifesto. That's like in the kit. And like, if you're getting started, those 3 books are fantastic. And then learning to use your voice, your connections, and your platforms to change the narrative. There are not a lot of groups working exclusively on aging, and there are fewer working exclusively on ageism. And it's cross-cutting. Penny mentioned earlier, I think about it like this, like the policy committee at the Commission on Aging is being dissolved, but we're putting policy in every work group. And as we lose funding for ageism specific organizations, it just needs to be in every organization. Like, no matter what people are doing, no matter if you're making tennis shoes or, the White House, ageism should be something that we talk about and something that we think about whether or not this is creating barriers for ourselves and for others. And I like to wear my aging hat, my pro-aging hat all the time. And I was at a party with some friends last year, and like standing in a group of people, and somebody I didn't know said something really ageist. And a friend of mine went over to them and said, "You can't talk like that around Erin." And I was like, yeah. We've made it. And these are my girlfriends who don't work in this work at all, but they just know because we talk about it and we talk about what is it like how do we want to grow older? How do we want to grow older together? And we can all do that. That's something that we can all do no matter the table that we're sitting at. Next slide, please. So what we can do, next right thing for this group, 2 things. I would recommend checking out Changing the Narrative's website if you haven't yet. They have a language style guide there that is fantastic, and they've put some others in there from other organizations. But it talks about things like, what do we call older adults? Do we call them seniors? Do we call them elders? Do we call them, what do people want to be called? What is a good way to talk about aging? When we were building the new senior center, was anybody part of this survey of active current members of the senior center and what we should name it? Do you remember this, Jody? And yeah, Melissa. So the word senior is a little bit fraught. And so the city was very rightfully so, was like, we're not going to call it the senior center. Let's call it something, because senior maybe is like the wrong word, right? And they polled users, and 77 or something % of current users of the senior center said, we want to call it the senior center. And we were like, okay, yeah, we'll call it the senior center. So with that being said, language style guides are great. And also I just check in with people. And next slide, please. So there's a QR code here for the World Health Organization's global campaign to combat ageism. They've put together what they're calling an ageism scale. It's 15 questions. It doesn't take long to take. And it's available on your phone. It's in a Google form. It just is in my Google Forms. So it's not like lockdown answers. Also, it will not be connected to you if you go on and answer it. They're using this survey across the world. It looks at how we feel about ourselves internally, and it's super cool. The way that it's being used is that, for example, in, where is it? A country in South America, maybe, I don't think it's Brazil. I'll just say Brazil, for example. They were going to initiate an age-friendly community program in a community in Brazil. So they gave everybody this survey. The survey tells you, how you feel about aging, how you feel internally about your own ageism, or about your own age. And then you get kind of a score for the community. They implemented the age-friendly community plan, and then they gave the survey again. And so this is like pre and post aging, like anti-ageism education and age-friendly design in communities. And they're showing across the world that when we talk about ageism, when we educate about ageism, when we combat ageism, people are living longer. There's a lower burden on the economy because people are saving better for retirement. They have better access to workforce solutions, so they don't need social services as much. There's less of a demand for mental health services and public health services in countries that have really robust public health programs. And so all of the data that I gather with this survey, I'm sharing back to the World Health Organization so that they can see the kind of changes that we can make here in the US as well. Next slide, please. So I love these quotes so much. Someone who was on this commission with us a couple years ago said to me, they were like, we're the adults in the room now, like we're the people doing this. So if not, like when we think about changing the narrative, when we think about ageism and aging in communities, if it's not us, then who is going to do this, right? The students in JAWS are looking to us. People at the Colorado Commission on Aging are looking to us. The city and the age-friendly community work here, they look to us. So if not us, then who? And if not right now, then when is it going to change? So thank you all very much. I love this group so much, and I'm looking forward to working on this with you guys into the future. So
thank you so much, Erin. I
Yeah,
appreciate it. Yeah. And
Yeah.
I just want to say I have a dear friend who's just turned 86, and he has a quote that says, it's a privilege to grow old because not everybody gets that privilege. So I always keep that close to my heart. But moving on, I know I want a report from Kathy and Wanda for the in social engagement. Turn your microphone on. I still want the group that wasn't able to attend, I still would like them to hear firsthand how it went. And I know Penny and Wanda and Kathy were all present.
And I did send a slideshow. So there's a slideshow and there's also the video that we can put up here when you guys are ready. The slides, the photos, I put 4 of them together. So it's not huge. And then there's the video. So depending on, just share some things, and then Cheryl can put up maybe the photos, and then we can close with the video.
That would be great.
Yeah, it went really well. I saw people talking and overhearing people saying they've never met a neighbor, and they've lived there 30 years or 15 years, and they'd never met a neighbor before. And they're in a trailer park, they're not that far apart. And then there was one lady there that said, she had someone walk into the back of her house, and our dean said, well, if you knew your neighbor, they might have saw him, called you and let you know that there was someone in your back area. And so then they started talking about how it was a safety thing as well as just a getting to know each other thing. So they committed to meeting regularly. And there was I think she's a manager, that said she'd never seen half the people there. She'd never even seen them before.
Wow.
At any gathering.
Mm-hmm.
So it was very good. I mean,
Very successful, it sounds like.
Yeah.
Wanda, what was your take?
It was really nice to see everyone just kind of gathering and chit chatting. I was trying to listen a little bit, but there's about maybe 25 to 30 people there, probably more than that. The space felt small really quick.
yeah,
And it got hot in there.
I couldn't move much because there were so many.
Yeah, but it was really good. We had Kathy opened up and, was grateful for everybody coming. We had Marilyn, I don't know her last name. Dawson with Hey Neighbor, very high energy, was excited to be there. So she was really fun to kind of connect and talk with too. But I think everyone had a great time. I had a great time. It was really fun. We had a wonderful waitress here.
Yeah, I was gonna say, Penny was serving ice
He was
cream.
serving, yeah.
She's going around with a
That's
tray.
only because I have zero creativity. And
Oh, come on.
the connector was Kathy. And then is there time to show the video?
Yeah,
show?
let's, if we
Yeah.
can we
I
show it?
mean,
Buses
the
coming, so yeah.
ambiance that Wanda just magically put
Oh, yeah.
together was amazing.
Yeah, everybody was
Amazing.
so great.
Cheryl, you okay back here?
She,
Forward it. Do you have the slideshow, the few pictures on it?
yeah, we can start with that at our next meeting. Yeah. Yeah, okay. Yep. And because there's not anybody here to report on the other ones, we'll just hold off on that till next meeting also. Are there any discussion items that any commissioner would like to bring up? Any member entity announcements? Hearing none. All right, our meeting schedule is listed. The next executive meeting will be the first Wednesday at 9 a.m. That is virtual. The next Commission on Aging meeting is October 15th at 3. And the policy committee meetings are to be determined. Working group meetings there are listed. And I think we
I
can.
do need to say something.
Sure.
The social groups will be changing back to monthly, but we kind of have to all agree on Thursdays or Fridays and around noon or what's the best time. So
Okay.
I sent out a text, so if
Okay.
everybody could just let me know,
Yeah, that,
then I'll compile.
and then we'll let them know. That's great. Well, I think that's it for today, and I'm sorry. Oh, okay. Yeah, that. Yeah, I think it's a
My
couple
bus
minutes.
is outside.
All right, great. Cheryl, if you could do that, that'd be.
It's good to see everybody.
Kathy, they're going to play the video.
Face to face.
Oh, okay.
Yes, sure, it's great.
It's great.
Thank you for coming, Kathy. Wow.
That's terrible.
That's great. Just great. Thank you so much, Cheryl, for all your work with the presentations. Appreciate it. And Tina, thank you for being here. Yep. Meeting is adjourned.